As a children's hospital, as a trauma center, you have got to be a part of the conversation for prevention. You would like to prevent people from using the trauma center because they wore seatbelts, they were appropriately safe as a pedestrian walking across the street, they had street lights and flasher lights in place, people were not distracted drivers or impaired during driving. How are we being a part of that conversation? Because that's really what makes a difference. We are going to be there as a trauma center to care for people if they're injured. We'd like to prevent the injury. And that's why we have to expand the conversation. Public education is only one piece of the puzzle. And we have, unfortunately, in this school year, experienced several young children in our community being struck by vehicles. And while the reasons for why they were struck may be varied, there's a responsibility to partner with others to make sure that we're getting to the root of that problem so that no family or child has to suffer in quite that way. And as a trauma center and as a children's hospital, it is our obligation to not only care for people when the accident has occurred, but to be a part of the voice that says, let's stand up for prevention and address the needs of our community and be part of the solution that prevents those children and families from ever experiencing that terrible tragedy. And whether the issue is gun violence, pedestrian safety, healthy air and water quality, or making sure that people get ample exercise and access to mental health services from a prevention, all of that is a part of the conversation for health.